The new Health Secretary Therese Coffey will today announce a new plan for NHS England, which she hopes will ease the health service backlog. And she joins us now. Good morning, Therese. It's lovely to see you, as always. Look, the NHS, no one doubts, is in dire need of some help at the moment. What are your plans?
Well, my top priority that I set out in our plan for patients is patients, and I'm covering in a variety of ways the things where patients rely most on access to the NHS, and that's actually through primary care. And that's why I've set out a clear expectation that when people phone up the surgery, first of all they get through, but also that they also can get an appointment, certainly within a fortnight, and for urgent cases, which many GPs are already brilliant at doing, getting that same day appointment so they can immediately get access to the care that they desperately need.
Common sense, lots of people will think this sounds brilliant, but how on earth do you magic up and make free more appointments when we have this shortfall of GPs and we know that funding is tight?
Well, one of the first things that we're doing is literally going through the data. Just over a week ago, we managed to get out of NHS Digital this performance by practice, and that shows a huge variation. So one of the things that I want to do is to not be prescriptive with GPs in how they interact with their patients, but to make sure that those service levels or expectations are met, and we want to work on a local NHS level to make sure that those practices that aren't meeting that expectation of patients being able to see a GP within 2 weeks, how we can help them do that. Now, there's a number of different ways that we're already signalling that we're doing this. One will be changing the funding rules so they can start to recruit more of some of the support staff, or indeed people like GP associates, to free up some of the time that GPs have so they can spend their appointments particularly focused on caring for patients, which is the thing they do best. But more broadly, I think this is about making sure that we have greater publication of data so that patients can be informed. So whether that's thinking about what is happening in their local practice, of course, not everybody can just choose or wants to go to a different GP. That's why it's that combination of working together in order to make sure that, as I say, when patients need the NHS, they can rely on it with confidence. And that's what I'm going to be doing. I'm going to be the champion for patients and making sure that we work together right across the health and social care environment. And that's critical too, as I'm conscious that while we've had a national emergency with COVID and the NHS, and care has got us through that for people who are particularly vulnerable, that national emergency is still continuing, and it necessitates a national endeavour. And that's why we're working hard to extend some of what we did in COVID to help with probably retired staff to come back into the NHS, but also many other measures which I'll be setting out in more detail to Parliament later today.
We were talking to one of your predecessors earlier on, Stephen Dorrell, and he said the issue that you've got to get to grips with part of this is you can't do any of it without significant increases in funding. And I know one of the things you've put forward is putting the weight of some issues onto pharmacies and community pharmacies. But again, they've complained about their contracts and the lack of funding for a very long time now. So this is going to involve cash, isn't it? Cold hard cash.
The NHS has had a substantial increase in funding. That is why they're starting to recover in terms of the backlogs and getting on with elective surgery. It's why we're already building diagnostic centres. And in terms of the pharmacists, we've just finalised the contract, which opens up this opportunity for more people. Instead of needing to go and see a GP to get a prescription, they can go direct to the pharmacy as well. So those sorts of elements where there is funding attached to that new contract, that's the sort of response that we're giving in order to help the front line, and I will continue to do whatever I can to make sure that patients can get access to the care and treatment that they need as quickly as possible.
Stephen was referring to Stephen Dorrell, former Health Secretary there, and he was also saying to us this morning, Therese Coffey, that one of the best ways to deal with this problem is to try and ensure that people stay well in the first place. And he argued that the downgrading of your obesity strategy at a time when there is unbelievable pressure on the health service is a mistake. Will you be looking again at that?
Well, in terms of thinking about prevention, and of course people not needing to turn to the NHS in the first place, of course that's an important part of our plan. A lot of this is building on existing NHS plans already, and indeed government strategies that are in place already. But we want to be in a case where people are turning to the NHS for help. The focus at the moment might ABCD, ambulances, backlogs, care, doctors and dentists. The reason for doing that is because that is where we're still seeing major challenges, whether in terms of access to care homes, people being discharged from hospitals in order to free up space for new patients coming in and getting ambulances back on the road. So that's why I'm focusing in particular on this, considering for this winter, but also building up sustainability and resilience for the future.
Just a quick thought. How soon can we see change? Will we see changes, do you think?
Well, we'll be bringing some of these flexibilities that we've listened to doctors, we've heard some of their concerns, we're addressing various of those concerns in order so that people actually stay in the workforce. I mean, we do have more doctors and nurses more generally in the NHS than even a year ago, and we continue to try and make sure that people don't feel that they are forced to retire, but we're doing more, and I'll be saying more as we develop the workforce plan.
Therese Coffey, it's good to talk to you this morning. Thank you.